Today, we're going to break down one of the most important procedures in modern medicine, the cesarean section, or C-section. We're going to get into what it is, why it's done, and walk through the whole process. So let's just dive right in.
So get this, almost 1 in 5 babies around the entire world is delivered by C-section. That's a huge number, and it really shows you just how vital this procedure has become for families everywhere.
Okay, so what exactly is a C-section? Well, simply put, it's a surgical birth. Instead of a vaginal delivery, doctors make a small incision in the mother's abdomen and uterus to bring the baby into the world. It's an incredibly safe alternative when a traditional birth might pose some risks. And that leads us to the big question: why is a C-section recommended? The answer every single time boils down to one word: safety. The entire decision is focused on protecting the health and well-being of both the mom and the baby. Now, there are a few common medical reasons this might be the best path forward. For example, if the baby is in a breech or feet-first position, or maybe a condition called placenta previa is blocking the cervix. Other big ones are if the baby is showing signs of distress, if the mom has had a C-section before, or if she's having twins or even triplets. In all these cases, a C-section is often the safest route for everyone. All right, let's get into the part that I'm sure a lot of you are curious about, the procedure itself. And it's important to remember this is a very controlled, very methodical surgery. It's planned out carefully every step of the way. So, what really goes on in the operating room? Let's break it down. First up is anesthesia. Usually this is a spinal or epidural block, which means the lower body is numb, but mom stays awake for the birth. Next, the surgeon makes a small, careful incision in the abdomen and then the uterus. And then the big moment, the delivery. The doctor gently lifts the baby out, and it's often just seconds before parents hear that incredible first cry. After the baby is safely delivered, the placenta is removed. And finally, the surgeon closes the incisions, typically using stitches that dissolve on their own. But, the baby arriving is really just the beginning of the story. The recovery period afterwards is just as crucial for making sure mom has a healthy, positive outcome. So what does that initial recovery look like? Well, for most moms, the hospital stay after a cesarean birth is usually somewhere between 2 and 4 days. And that time in the hospital is so important. It's not just about resting, it's for active monitoring. The medical team keeps a really close eye on the healing process, and they're there to help prevent any potential complications, like an infection or blood clots. It's all about ensuring the safest possible start to this new chapter. When you boil it all down, this is what it's all about. A C-section isn't just a surgical technique, it's a truly life-saving innovation. Its goal is so simple, but so profound: a safe birth that leads to a healthy mother and a healthy baby. And that right there is everything.